Colloquium. I'm Dr. Randa Garden, and I would like to introduce my very special communication honoree, Aubreanna Miller. I have had Aubreanna in 3 of my classes, including organizational communication, health communication, and qualitative research design. So I have been able to observe her character, intellectual ability, and scholarship, all of which are impressive and outstanding. Last semester, I submitted a paper Aubreanna completed in my organizational communication class to the Flatwater Communication Conference, and it was selected as top paper at the conference. The title of Aubreanna's paper was Grin and Bear It, Emotions of a Small Town Journalist. Aubreanna also completed a literature review of the Rural Health Network in Nebraska in my health communication class. For her honors project, Aubreanna developed a research proposal that builds upon her health communication research titled Utilizing Collectivist Messaging to Enhance Health Communication for Native American Populations. I have really enjoyed working with Aubreanna as her advisor. Please welcome Aubreanna Miller.
Okay, so my title is, as Dr. Garden said, Utilizing Collectivistic Messaging to Enhance Health Communications for Native American Populations. And at this time, I would like to thank Dr. Garden for all of her help with this project. She was really instrumental in this process, and without her, I would have felt very lost. Last semester, I took her health communications class where the foundations of this project began, and she allowed me to use that class to do the background research for my honors project, which was really awesome. And then this semester, I took her qualitative research design class, where I learned methodologies for conducting a research project like this. And it was really cool to take the lessons that I learned in class and directly use them in a real life setting like this. So thank you, Dr. Garden. Getting started, my connection. So I was editor-in-chief of the Wayne Stater last year, and in February of 2022, I wrote an article entitled Survey Helps Formulate Area Health Initiatives. And through that, I learned about the Northeast Nebraska Rural Health Network and how they work to solve community health issues in Northeast Nebraska by conducting surveys, having roundtable discussions, and meeting with other important leaders in the area of Northeast Nebraska to find out what the biggest health problems are in this area and how to combat that. And so this survey sent out included 11 questions, such as what is the major health issues in your area, and what was the last major health issue you and your family have experienced. And these open-ended questions were designed to gather input to give local leaders in the area insight into the health problems that people in this area face every day. I learned from Julie Rother, she's the director of the Northeast Nebraska Public Health Department, that the Rural Health Network was formed in 2017. And every 2 years, they come together to have a community health needs assessment plan. And so the last one was in 2022, the next one will be next year. And these are all of the organizations within it. So it's the Northeast Nebraska Public Health Department, the Midtown Medical Clinic in Norfolk, Pender Community Hospital, University of Nebraska Medical Center, Providence Medical Center, Wayne Family Medicine, and the Winnebago Public Health Department. And in summer of last year, in 2022, I started working for the Wayne Herald, which I have been working at for a while now. And through that, I was able to go to the second installment of their process, in which all of these leaders from all of these areas, plus local business leaders and community stakeholders, came and they discussed what the top 3 health problems in this area were. And obviously there are more health problems than just 3, but they thought by focusing on 2 or 3 problems that they could really attack and find out ways that they could combat these issues. And after this meeting, I went home with the beginnings of ideas for my honors project, as well as writing the article, Meeting Identifies Prominent Local Health Issues for the Herald. And after 2 semesters, Dr. Garden helped me decide that not only is this something that I can research now, but it's something that I can take into my higher education programs. And the prominent health issues that they found during that meeting were mental health, chronic disease, and health behavior education. So how can they combat mental health, chronic disease, and then inspire health behavior education and get people to take an active role in their own health. And I knew in my honors project that I wanted to talk about the Northeast Nebraska Rural Health Network and their health plan, but after learning about cultural communications in the health communications class, I pivoted to a more specific topic of Native Americans within this area, because there are obviously the Ponca and Winnebago tribes in this area, and so their roles within this network are very important and very specific. And so I became incredibly interested in how different cultures view health and how that affects their communities and vice versa. So this is a proposal for a narrative inquiry, which I will get into later in a subsequent study. I really am passionate about health communications, and I know that I can take this research further into a PhD, master's and PhD program, hopefully at UNL. That's where I'm fine. And the purpose of this narrative inquiry will be to develop the best practices for the Northeast Nebraska Rural Health Network during health communications with Native Americans living on reservations in Northeast Nebraska. And at this time, I would like to put in a short disclaimer. In no way am I claiming to be an expert on Native American communication, and I'm also not putting myself as a spokesperson for this minority population. My intention is to offer a platform for the voices of Native Americans in Northeast Nebraska, and then by having conversations with community members and local leaders to reveal any communication gaps and educate both parties through my knowledge of health communications. So I just wanted to add that there. So my rationale for my research is culture affects communication, and communication obviously affects health. I focused on collectivistic versus individualistic mindsets and how inherited traditions and belief systems affect health communications. Native Americans tend to have a more collectivistic culture. In a collectivistic culture, community members focus more on the interdependent self rather than the independent self. And this interdependent self is characterized as being embedded within the social context and defined by social relations and memberships in groups. And people are more communal in their decisions, and actions are heavily influenced by social and mutual obligations and the fulfillment of in-group expectations. Some cultures respond better to different forms of framing when looking at health. Collectivistic ideologies held by Native American population makes them more responsive to loss frame messaging. And so a loss frame message highlights what a person will lose without taking a certain action. So I know that sounds like a lot, so I'm going to give you an example that'll help you understand a little bit better. So say you're watching a commercial on TV about flossing, and the person says that if you do not floss, you will lose your teeth. That is focusing on what you will lose. That is loss frame messaging. And then as opposed to gain frame messaging, if you're watching the same sort of commercial and it says, if you do floss, then you will keep your teeth and have healthier teeth overall. That is gain frame messaging. And so I thought that was really interesting when I learned that, how looking into the culture of Native Americans, they would have a higher inclination to stop a poor habit or start a healthy one if told about the consequences that they may face instead of what they may gain. And similar to loss frame messaging, Native Americans also respond better to messaging that holds focus on community and comes from someone who understands the metaphors passed down through generations and then also utilizes local resources. This comes from a study in 2012 on over 900 American Indians and Alaskan Natives. And through this, researchers found the most preferred methods of health communications and ways health practitioners could implement cultural sensitivity into their interactions with their patients. The most common method in which Native Americans seek medical care comes from members of their family, followed closely by health practitioners, but it mostly comes from family. And family is a different term within their society than the average nuclear family that we would think of, like mom, dad, brother, sister, children, you know. Family is more large extended families or clan-based, and they are very important to the familial structure. And the use of these large kin networks in Native communities can be very useful in providing health information. Media sources acted as the third highest channel of receiving health information, but that more included books, newspapers, and magazines as opposed to the internet. And that's because in a lot of reservations they don't have access to internet. And that might not be the case here in Nebraska, but in a lot of places in America, they don't have access to internet. And obviously this study was done in 2012, so that probably has changed a little bit as time has gone on. We all have relied on the internet more than in the past. And so as younger generations start having active roles in their health, this has gone up and the internet has become more prevalent in society. And the study also found a preference for visuals over numbers. And so graphics and pictures as an avenue of sending health materials reflects the inclination of Native Americans to use art as a way of sending messages. And furthermore, the Northeast Nebraska Rural Health Network works to assess health within local communities, but they might not fully understand the need for different messaging between, say, Wayne and the Winnebago Reservation. Julie Rother said, "There's great variance within the Native American never mind, this is not from Julie Rother, so sorry. There is great variance within the Native population in terms of obtaining and using health information, and the majority do have concerns regarding the quality of information that is sent to them." This is similar to other populations. Obviously, we all probably want to question. It's a good practice to question where you're getting your information about health communications. And it highlights the needs for health communicators to take into account the multitude of factors involved in providing health messages, from individual reading skills to education level, culture and social context, age, and obviously collectivistic versus individualistic mindsets. And the current assessment highlights social determinants of health and health disparities within the Northeast Nebraska Rural Health Network. Now we're talking about Julie Rother. Our health is not just dependent on whether or not we can go to the doctor, she said. A good portion is dependent on our environment around us. When people do not have access to some of those things, that's when we run into health disparities, where people are just not able to achieve the maximum health that they could if they were living in optimal environments. Specifically, access to healthy food, affordable housing, an environment that encourages physical activity, and more. They all go into the social determinants of health. And these disparities differ greatly between the reservations and surrounding communities due to the nature of each entity. And to find the disparities, the Northeast Nebraska Rural Health Network must change their tactics of communication between the various populations. This leads to the questions that will further drive my research and narrative inquiry, which I will explain. And so these are my questions. Through this understanding, what sorts of framing messages has the Northeast Nebraska Rural Health Network or health organizations within the reservation sent out to community members? How have locals responded to these messages, and how can these individuals find empowerment to aid in the curation of these messages? And then finally, how can these messages lead to overall healthier communities? To find this out, I plan on conducting a narrative inquiry. So a narrative inquiry studies the stories of an entity that explain a certain experience. So this experience would be living on a reservation, and that context would be healthcare. There is a collection of stories, and they tell how people see themselves. They happen within a set context, place, and situation. and they're collected through several forms of gathering data, including interviews, reading written reports, and studying nonverbal cues and more. Obviously, as a journalist, I've gone through many interviews and reading reports and studying people's nonverbal cues, and so that would help a lot. And then the data collected is analyzed using several strategies, which I got to learn in my qualitative research design class, which is awesome. And they're shaped into a chronology, and I would be focusing on an oral history, so by asking people their stories and finding the themes through that, then we could write it up and then hopefully have presentations to both sides and help bridge those gaps. Okay, and then I wanted to get into my interview questions for Dr. Garden's class. We had to come up with a list of questions to follow, and so I included those here. And these would be for community members, leaders, and educators within the reservation. I do not yet have a list of questions that I want to ask the outside groups, like those from the Northeast Nebraska Public Health Department. I haven't put those together yet, but obviously as a journalist, I would probably have a lot more questions, and questions lead to more questions, you know how that goes. So this is just kind of an outline. Obviously, I would ask for demographic information, and then how long have they lived on the reservation? How long has their family lived there through generations? What do they feel are the most pressing health issues on the reservation? How have they seen health communicated to them through methods of, or from reservation leaders? How is health communicated in school settings on the reservation? What kind of changes have they seen on the reservation throughout their lifetime? How have beliefs regarding health in the community changed with each generation? What should people off the reservation know about life on the reservation? Obviously, I honestly have never been to the reservation, and so I don't really know exactly a lot about how life is on the reservation, so I assume not a lot of other people do either, and that would be a really great teaching moment. What sorts of health remedies have passed down through your family's history? What influences your decision to seek professional medical care? And do they often seek it from themselves, family members, or friends? And if they do decide to seek outside medical care, do they stay on the reservation or go off? And what factors influence that? And then how do they feel that area governments could better support those in their community? And then the most pressing health concerns, again, were mental health, chronic disease, and health behavior education. So how have they seen local leaders implement change in those areas over the past year and a half? And then do they believe that those are the most pressing issues in their area, or do they think that there are other issues that affect them more? And then how could the Northeast Nebraska Rural Health Network better support reservation leaders in implementing change in the above areas? And that is the end of my presentation. Thank you. And now we have time for questions.
Yes. So I want to give the audience a chance to ask Aubreanna any questions that you may have about the research, but I would like to start with the first. What was the most important thing you learned from reviewing the literature about health communication for Native American populations, would you say?
I would say that the most important thing I learned is that every healthcare practitioner needs to have a background in culture, in learning culturally sensitive health communications, which we learned in class, and have that understanding that not everyone is going to take everything that you say the same way because of their background and how that affects the way that they understand, how that affects even them reaching out for help when they have a health issue. And I remember in class we watched a video, or I think you gave an example of someone who was Hispanic who was told to take 11.
Oh, once.
Yes.
Once.
Oh, to take
Yeah.
pills once a day. but in Spanish,
It's-
once means 11,
once
so
means
she took
11.
11 pills
Yeah.
a day. And so, yeah,
You remember that?
yeah. So every healthcare professional needs to have a background in culture.
Yes, yes.
Sean.
So I have just two comments.
Right.
I think what's really interesting about doing oral history in a creative setting, a couple things you have to keep in mind is that there is no universal reservation experience, especially since we see a lot of older histories of Native people on the loss of land in the 1960s and the final proclamation of this government, things like that. So the idea of reservation life is definitely depends on the state, depends on the region.
Right, yeah, that's why I wasn't going to have this be like a comprehensive thing. That's why I wanted to focus more on Northeast Nebraska specifically.
And I think to that point, what could be really interesting to do as a part of that conversation, Aubrey, is,
Sorry.
it's fine, happens to the best of us, is you should look at the work of John Mohawk, who was, well, he was Mohawk Indian. He's also got a lot of ideas on how healthcare intersects with sovereignty. And so when you're talking about the conversation about finding Western medicine off of the reservation, there's a conversation there about colonialism, there's a conversation about sovereignty and everything as well. It would be interesting to unpack some John Mohawk sort of things in the
Thank you.
Anyone else?
How do you plan on getting in contact with the people in the
Yeah, so I've already talked to Julie Rother from the Northeast Nebraska Public Health Department before, obviously because I work for the paper, so I get to talk to a lot of important people in the community. And I know that she would be able to get me in contact with like the leaders within the reservations. And Winnebago has their own public health department. I don't, Ponca does not, but Winnebago does. And so reaching out to their director would be a great start. Yep.
I was just going to mention that Zach Dries, who works at Wayne State, has a lot of connections with the Native population as well, so he might be able to give you some names of people who already work at Wayne State maybe, or who would be open to talking with you more about this stuff.
What was your favorite part of this whole process? Like the research and putting together the presentation and all of that?
Yeah, I think my favorite part honestly was when last year it was like 2 a.m. I was in the Stater office and I was running my first installment of this because it's like a 2-semester thing. So my paper was due like the next day. I had like 70 pages worth of essays due at the same time. And I was writing it and it wasn't really coming together very well and I was just very tired. And then I started looking into the gain frame messaging versus loss frame messaging and then it kind of just like clicked. And I remember the moment I like sent someone a video, like they did not know what I was talking about at all. I was like ranting about how I was so excited that this was coming together. And yeah, I think that would probably be my favorite part. I definitely think that's notable. And then also interviewing people just as journalists, that's like my favorite thing. That's why I decided to, I know there are other methods of conducting research like this, but I just like a narrative inquiry because I get to listen to people's stories, and I think that's really important, especially within like a cultural setting like this, to hear the stories of people that have been passed down through generations. It's cool.
How will you make sure the study remains ethical and culturally sensitive?
Yeah, that's a great question. That's why I wanted to add in the disclaimer, because as I was doing this, I was like, at some points, I was like, I realized that I've never been on a reservation. I know I'm obviously not of Native American descent, and so I wanted to make sure that I was doing everything in a culturally sensitive way as we learned in class. And so I think it would be good to partner with someone who is of Native American descent, kind of like making movies. Mike White would say, you always want to have someone in the director's team if you're having a movie about like a specific culture, or I don't know, you know what I mean. But yeah, just to work with someone who has that background so that they can advise me through that and make sure that I'm giving a platform for other people to speak instead of just drowning out voices and talking myself. Yeah.
What questions would you ask members of the Northeast Nebraska Rural Health Network that are outside of the reservation?
Yeah, I was trying to think of a list of questions that I would ask, and I would probably ask what sorts of things that they have implemented to help combat mental health issues, chronic disease, and help implement health behavior education into other areas. I would also ask them how they have discussed health communications with the tribes in the past and what has worked, what hasn't worked for them, and if they have any background in health and cultural communications, and if that's even something that's on their radar, which I hope that it is. And so I'd like to know kind of the practices that they have had in the past, and then see what things maybe need to change.
I mean, we study in qualitative research design 5 different approaches to qualitative research. And you had indicated that narrative inquiry was what you wanted to do so that you could, you know, do the interviews. And I can see why, with your background as a journalist, that you would want to do that. So you'll be very good at that.
Yeah, I chose health communications because I really like environmental stuff, and I like to see how people's environment affects them and how they affect their environment. Unfortunately, environmental communications isn't really a thing unless you want to go into PR, which, sorry for anyone that's in PR and healthcare leaders, not really my thing. So this is like the closest that I can get to that.
I think you'll be in good hands if you go to UNL.
Yeah.
Have you found it, the same geographic area also has another cultural entity, the Hispanic population. And you might think about expanding and doing the same geographical area, but then comparing the different kinds of cultures there. That might be another interesting aspect to look into.
So many ways you can expand.
Yeah.
And I would implore that you look at the intersection there as well, right? And also, if you're worried about not having Native voices, look into Native scholars who have engaged representations of Native people in Western culture, things like that. That will help have an impact to the history.
And I suspect there's people in this room that are going to hear Laura's presentation in a minute. So we should probably wrap this one up.
Have fun.
Thanks. Make sure they don't.
Well,
Well,
you're not coaching them, so.
I am in a way though.
Yeah.
I mean, I was back.